So when we look at the COVID-19 vaccine and its development, the side effects to vaccinations can be very variable because what you're doing is creating an immune response. You're making your immune system, react to the vaccine. And these are things that are safe, they are temporary, and in the majority of cases, many people would just have very mild symptoms where it goes away and really nothing lingers for longer than a short period of time. If we were to compare the side effects of a vaccine and then you were comparing it to the greater concern, which is infection with COVID-19, that concern is it should be, your worry should be minimized because being sick with COVID-19 carries much more variables and much more complications. So looking at it that way, it's always better to know that, even if there was some fever or feeling ill for a short period of time, it's better than getting sick with COVID-19. Yeah, it's important to know that with the mRNA vaccinations, as well as even with the Johnson & Johnson vaccine, there was a lot of people in this country, as well as many other countries, scientists, researchers, and just in development and people that were participating in studies that really took precedence because the importance of getting this vaccine right and getting it out to the public was very important, and it was really timely, and having the vaccine as soon as we had it saved a lot of lives just based upon looking at information that's out there. But really the worry of it being rushed or accelerated, it still went through the same checks and balances, the same safety profiles, the same evaluations that any medication hitting the market would. And it's true, every year the flu vaccination gets remade or reevaluated. And it's not to say that the COVID-19 vaccine is any less safe. They're equally safe. And it's really important to know that whenever thinking of a vaccine, you think of the vaccine and its benefits and risks, and then you think of the infection you could get and the risks of that, and then you have to weigh that decision. But knowing what COVID-19 potentially could do, what could, and it's not to say it's what it could do to you, it could say what it could do to another person or what the spread could do. It's always important to consider that. Yeah, no, and the thing is, it's important to know that these vaccines, the technology has been around for a while, and it's been looked into and evaluated and used in other infections. What's important to know about these vaccines is they are highly safe because the adverse events or adverse outcomes that are listed as considered to be dangerous have not occurred with these vaccines. We see when you're comparing the vaccine to the actual infection, way more complications, obviously, with the infection. But it is definitely noted that in this country, millions upon millions of Americans have received the vaccination. And the vast majority of them really, even if they had very mild symptoms, got over them relatively quickly. And it benefits you to get vaccinated because if you were, say, exposed to COVID-19 from a loved one, a family member, someone that, a friend, or even at a party or event, you have a much better chance of battling or preventing infection. It's the equivalent of, say, if you were going to go into battle with no weaponry, you have no defense mechanisms, you have nothing, you would be defenseless. And if you were to say, what advantage do I have there? You want to at least have some benefit or be at least on the winning side a little bit there. So COVID has really changed the entire world. I mean, it's if you were to say it's not a threat, everybody knows about it, everybody thinks about it, and a lot of people are very concerned about it. And so it has invaded a lot of people's personal space. People have lost loved ones from COVID-19. People have been put on oxygen who weren't on oxygen before COVID-19. And really to say it's not a threat is definitely not true. I would strongly, state that it is a threat and that we have to do our best to prevent spread, our best to prevent, death from COVID-19, and our best to, prevent just, these complications. And the real best way to do that is vaccinating, because you always want to be ahead of the infection. You want to be, several steps ahead so that, we don't maybe have the complications, or we don't have, the death and complications from COVID-19. I think it's important also to note that, if people are even considering pregnancy, getting vaccinated is strongly encouraged. It's recommended by the American College of Obstetrics and Gynecology. It's also important to know that, having those antibodies when your child is born, they get antibodies as well from the mother. And so having that protection can protect them. It can protect them if you're going to consider breastfeeding as well, your children. And so it's just an important aspect, because being sick with COVID-19 during pregnancy is very complex and can lead to complications down the line. And so we always want to just encourage people that we're not worried that COVID-19 vaccine will cause harm, because there has been no evidence to show that in pregnancy. And lots of women, there's databases online where women even register that they've gotten the vaccine while pregnant or before pregnancy, and they were doing just fine. Yeah, speaking about allergies to the vaccine, so if you were to, like, say, go online and use a web search and look at Pfizer, the components, what's in the vaccine, the only contraindication to these vaccines is if you had a severe allergy to the first shot, if you got Pfizer or Moderna, or you have an allergy to one of the components in the vaccine, and it's a known allergy to it. But to say, like, say, for example, you can't take vaccines for whatever reason, it's not as strong of a contraindication to say you can't get the vaccine. It really has to be one of those two things. I got the first shot and I had a bad reaction from it, or I'm allergic to one of its components. And it's all public information. And we know now even the FDA approved the Pfizer vaccination, and will likely approve the Moderna as well as Johnson & Johnson, come, just having the data come in front of them. The goal here is just getting to that point, but we do know it's safe, it's effective, and that's what you want out of a vaccine. You want it to be effective, you want it to be safe, you want it to be protective.